If you feel a stabbing pain right in your elbow, like you could point directly to it, then you found the right video to fix it for good. In this video, I'll talk about the anatomy of the affected area, I'll talk about what causes it, and how to get rid of it in 5 easy steps. Lateral epicondylitis, or tennis elbow, is caused by overuse of the extensor muscles on the forearm. Fun fact, the majority of people who get tennis elbow don't even play tennis. There are 2 basic muscle groups of your forearm. The top muscles are called your extensor muscles. They lift the hand and extend your fingers. And the bottom is your flexor muscles. They bring the hand in and bring the fingers in like so. So if your hand's going up, that's your extensors. If your hand's going down, that's your flexors. Most of your extensor muscles originate from this lateral epicondyle. Earlier, I called this condition lateral epicondylitis. That's the medical term for it. What that means is lateral is like the outer portion. Epicondyle is your humerus has they have 2 balls at the end. You have a lateral epicondyle and a medial epicondyle. That lateral epicondyle is the outside of it, and itis just means inflammation of. So the whole word is inflammation of the lateral epicondyle. That's where they get the name from. And you have a muscle right here called the extensor carpi radialis brevis, and that muscle that connects to your lateral epicondyle, that's the one that gets inflamed. When that tendon that attaches the muscle to the bone, when that gets overused, when that gets inflamed, that's where you get your tennis elbow from. So what causes tennis elbow? Well, there's several different things that could cause this. Working out at the gym can cause it if you do a lot of reverse curls or incorrectly do lateral raises, activities with excessive flexion, or maybe your job requires you to your wrist in one way or the other to be in that position. Like if you type at a desk a lot, just your hands being in that slightly flexed position can cause inflammation of that tendon. Sports can cause it, and yes, even tennis can cause it. No matter what the cause is, overuse of these muscles can cause micro tears in the tendon itself. Now, micro tears themselves aren't bad. It's just when the degradation of the tendon happens quicker and more rapidly than the regeneration of the tendon itself, that's where the problem's at. Also understand that just because the pain's happening now doesn't mean the problem happened now. This is something that could have been going on for a while. It's just now, basically rearing its ugly head and now becoming a problem. But this problem could have started, a long time ago. Let's talk about how to fix it. Step number 1 is reduce the inflammation. Whenever we're talking about reducing the inflammation, we just need to remember RICE. Rest, ice, compression, and elevation. First of all, rest. Give yourself some time. If you can, really just immobilize that whatever, elbow it is. Immobilize it as much as you can. Give it as much rest as you possibly can. If this is work-related or the cause seems to be what you're doing at work, as much as you can, give it as much rest as it can, because it needs time for that inflammation to go to the area, to heal that area, and that way you can move on to the next step. The next step is ice. Ice that area. If you have like an ice pack or something, you can put it directly on that. Cool thing is, 2 of the steps, ice and compression, you can do at the exact same time. They make these basically straps that you can put an ice pack inside of it, and it straps around the elbow itself. If you have something like that, of course, that would be best. But if you don't, just put some ice in a bag, put like a towel around it, and then take some rubber bands and attach that directly to your elbow or to the infected area. That way you get some compression in there, and you also get some ice in there as well. The last step is elevation. So elevation isn't super important whenever we're talking about like elbow inflammation. And the reason is because it's already kind of, just about equal with your heart anyway. If you were to elevate it here, that's something that it could be good to do, but it's not nearly as important as if we're talking about like a knee injury or an ankle injury or something, well below the heart. Step number 2 is reduce sensitivity. Whenever a body part gets hurt, your body tends to, not tends to, but it can overreact. That way the area feels more painful than it actually is, because it's in a state of hypersensitivity. It says, hey, whatever you're doing, I need you to stop doing it. So it almost overcompensates for the pain that's feeling. And an easy way you can reduce sensitivity is just, rub the area, massage a little bit. You don't have to do it hard. Just lightly rub the area, almost like you're letting your elbow know, like, hey, it's okay. We'll be all right. It's okay. We're fixing it. And just reduce that sensitivity by just some light massaging and just, maybe even working around the area to try and break up some of that scar tissue that may be in there, and just getting used to, touching the area. Step number 3 is stretching. Now, the stretch you do to stretch these muscles is very easy. You can do it anytime, at any place. First thing you'll do is you'll extend your arm out, fully take it out, and then you'll just put your wrist down like that. Now, for some of you, this may be enough to feel the stretch. If it's not, you'll take your other hand and then put it on your palm and basically just pull it back to you like that. And you'll feel the stretch right away. Make sure you keep your arm extended and don't put it here, because here it's in an extended position. You'll feel the stretch. But here, if you just did that, I don't feel anything in my forearm because it's not in an extended position. It's shortened, and I'm basically lengthening it, but not to the point where it gets a good stretch. So you'll go down, and you'll also hold it up as well. And both positions, down and up, you'll hold for 20 seconds apiece, and you'll do that 3 times. If it was me, I would say do it, maybe once a day, just to kind of get those stretch, get them nice and loose, and get them ready for the next steps that we have. Keep in mind, steps 1 through 3, these are very temporary solutions. These are Band-Aids. If you really want to take care of the pain permanently and keep it away, you must move on to steps 4 and 5. Step number 4 is active range of motion. After you've gotten some rest, reduced sensitivity, and stretched it out, now it's time to get your wrist moving back in the way it was designed to. So all you need to do is sit at a table, sit at your desk, and just let your wrist hang off like so. And all you're going to do is just bring your wrist up, let it go back down. Bring your wrist up. Whenever you're at the top, whenever you're in full extension, you'll hold it for 1 second. So you'll come up 1 Mississippi and then go back down. So whenever you're in the upward position, don't just let your wrist fall. Slowly bring it back down, because then you're getting concentric movements and eccentric movements. You're getting good motion back into your wrist, good, nice, controlled motion back into it. And you should feel the pain start to relieve around 10 reps or so. Altogether, you're going to do 1, maybe 2 sets of 30 reps with those 1 second holds at the top. Finally, step number 5, strengthening. No pain fix routine is complete without a little bit of strengthening. I have 2 exercises here for you. The first one is going to be the same as the active range of motion work, but this time we're going to use a dumbbell. Now, I'm here using a 3-pound dumbbell, and you wouldn't want to use any more than like 5 pounds. It's because you really want to keep the weight light, do good, solid, methodical reps, and that way you can really work on strengthening these muscles and getting them back to a place where they'll be strong and pain-free. So we're going to do the same thing. We're going to sit at our table or desk, let our wrist hang off, and we're just going to bring it up, hold it for 1 second at the top, and slowly let it back down. When we are coming up and down slowly, we're getting both eccentric and concentric work in this exercise, and you want both to really strengthen these muscles. So again, you'll come up, hold for 1 second, and let it go slowly back down. If 3 pounds is too much and you really need even lighter weight, you can get something like a soup can. Something real light like that, hold it in your hand, do the exact same work, and it'll strengthen your muscles the exact same way as this. And then you can work up to a 3-pound or a 5-pound weight. A good variation you can do of this exercise is with a resistance band. If you don't have a dumbbell or don't want to use a dumbbell, you can use one of these. And the reason why I like using these is because you can instantly adjust the resistance as you need. If you need more, you can go more. If you need less, you can give it less. And so all you do is you'll stand on the resistance tube like that. Again, you're going to be in the same position at your desk. You're just going to come up, hold it for a second, and go back down. And if I need more resistance, I can just step on more of it, and then instantly I have more resistance if I need, or if I need less, I can step on it and have even less. Exercise number 2 is called supinator rotations. Now, a muscle I haven't really talked about in this video is called the supinator muscle, and that sits right here. That attaches to your lateral epicondyle as well, and working that muscle can help with the inflammation in your forearm as well. So all you're going to do is you're going to take your weight, and instead of holding it right in the middle, we're going to hold it on the outside. So you're going to hold it on the outside. You're going to be in the same exact position as the other ones, except now you're going to rotate your wrist up and rotate your wrist back down. Now with this, you won't hold it either way. You'll just slowly go up and then slowly go back down. If it helps, think of 3 seconds up, 3 seconds down. 1 Mississippi, 2 Mississippi, 3 Mississippi, and then 3 Mississippis back down as well.